Welcome back. Mental health is an issue that touches all corners of our communities, but there are some unique challenges that minorities face when trying to access care. Dr. Andrea Rogers, a director of development at Hegira Health, joins us now to talk about a virtual town hall that's going to help provide some much needed resources to communities who really need access to more conversations about mental health care, and resources as well. So thank you for coming in for us.
Thank you for having me.
First, why the big disparity?
You know, over time with communities of color and BIPOC individuals, there's issues with systemic oppression, there's issues with access to care, and there's the overall stigma that we need to discuss.
And I mean, just growing up, I always heard pray on it. And there's nothing wrong with that, I want to say.
Absolutely.
As, you know, someone who's strong in my faith, but
sure.
Also having been in therapy, that truly helps as well. And there just seems to be such a disconnect sometimes between generations, and then just in, I don't know if it's pride, but something just seems to be blocking you from going to get actual help.
Well, Minority Mental Health Month was started by B.B. Moore Campbell, and one of the things that she said was people of color don't want to have just another thing against them, another disparity. So that causes us not to even reach out for help.
Where are some areas where we're seeing the most disparities?
You know, access to care is really one. There's care out there available, but when in crisis, people don't know who to turn to. They don't know who to call or what should I do.
What do you recommend people do? Who are some good go-tos?
So first, I always say start with your primary care physician. If you have questions and you don't know where to go. If you are asking the question, should I reach out to help? Go ahead and contact a mental health professional. That is what we're here to do. We'll do the assessment for you.
There's fear about money. I can't afford something like this. I can just talk to my girlfriends. I mean, all of these things sound small, but they are things that keep people from seeking actual help that they need. And then how do you know what's just, you know, a couple of bad days and something that mom and them can get you through versus you need to go and speak to somebody and get a treatment plan about this?
You know, you bring up a really good point. Natural supports are important. We talk to our girlfriends, we talk to our hairdresser. But I equate mental health to physical health. Sometimes you just need a checkup. Sometimes you need to go to urgent care. Sometimes you got to get to the emergency room. And so the thing that's most important is don't assess yourself. Reach out. We're not going to say, oh, you shouldn't have reached out or you did something too soon. Reach out, pick up the phone. Hegira Health is here to help. 988 is an immediate resource as well.
Anything specifically regarding men as well? Because that seems to be another challenging sector.
You know, with men, there's so much pressure as providers, as protectors, but mental health is so important to men because it can affect their physical health, their brain and their heart. And so for all the men out there, please reach out and get the help and the support that you need as well.
Tell us again where we can find you.
Hegira Health, we're on all social media channels, and you can reach us at 734-458-4601.
And this town hall?
Yes, we're having a town hall Wednesday, July 31st. You can register via all of our social media channels. We're going to be talking about advocacy and resilience in minority communities.
These Zoom links and town halls have been all the rage lately.
Yes, it's accessible to everybody.
Yes, love it. Very good. Thank you so much, Dr. Rogers, for coming in.
Thank you for having me.
Nice meeting you.
Nice to meet you.
Quick break. We'll be right back.